right. All right. Thanks, Vincent, for doing this webinar with me. I'm really excited to be here with you to partner with TalaDerma and AMiKO. Hello, everyone. I'm Karla. I'm the founder of TalaDerma. And like many of you, I come from the treatment room, so I understand what it feels like when you give your client your best work and sometimes things don't happen as planned. And that's really what inspired me to create TalaDerma. I have been in the industry for about 2 decades now, and I am still practicing in my treatment room and also as a product developer and educator. Vincent, do you want to go ahead and introduce yourself?
Oh, sure. Thank you. I'm so excited to be here. My name is Vincent Kolb. I am an educator and skincare professional. I've been working in the skincare industry since 1996, first at Saks Fifth Avenue in retail, and then I went independent with some niche organic skincare companies, notably Dr. Dennis Gross, MD Skincare, chemical peel background, and also now a technician and service provider as well. And I'm excited to be a part of this wonderful webinar. Thank you.
Thank you. So what brought us here to this webinar was this photo here. I posted this photo on Facebook on an esthetician group. I posted it on my Facebook. I posted, I think, on like 3 places, and altogether, I had just on one posting, I think I had over 300 inquiries on what I did with this client here. And so, with all that interest, we thought we would create a webinar and talk about it, talk about what I did, the products we used, and what they can do for you in your treatment room. So this year's the before and after of the clients. So the photo to the left was before any treatment we did. I did an AMiKO peel on her, and then I used a TalaDerma booster. I used a collagen and firming booster on her, and um, and then she's using TalaDerma in her home care. Do you have a question?
Yes, would you enlarge that photo full screen for a minute so we can see a true before and after? It looks amazing.
Oh, I want. It might not be full screen for you, depending on your view, but
Oh,
it should
okay.
be. Yeah, it should be full screen. Okay.
Oh, it is.
Yeah.
Okay. I see full screen, but I'd like to see a more magnified version of the before and after. I didn't know if that was available.
Yeah. So this is the before and after. Before we get started into the products and what was done, I did use a skin analyzer just so besides the before and after here, you can see the actual changes in her skin. So I threw this into the skin analyzer, and we are on texture on this photo here. So the dots or what you're seeing on her face is for the texture analysis. But on that middle column, in that middle column there, you can see redness. This is her before, this is her after. Before we started, her redness was at a 59%, and after she's at 48%. So she saw a pretty good improvement in redness overall. Spots or pigmentation on her skin went from a 55 to a 21, which is pretty huge. And then texture. And texture is highlighted here because that was the client's primary concern was texture. And her texture went from a 46 to a 31. So with texture, the lower the number, the better your skin is. And then you can see, pores are not doors. We can't get rid of them, but there was a little bit of improvement on her pores or dark circles, acne. And then the analyzer also gives you biological age based on what it sees overall. So you can see there the improvement on her skin on pretty much every category there. Go ahead.
Sorry, I
You're
don't
good.
want to go off topic or on a tangent here, but could you give us like a 30-second of how this machine works, this analyzer? Because I'm pretty intrigued by it and the results are compelling.
Yes. And if anyone's interested in the analyzer, reach out to me because I can give you a lot more information on that. There's a couple of different tiers to this analyzer. This one here is the like full face analysis here, and it's doing analysis on overall the entire face. It also does 2D and 3D, which you use the device and selected areas of the face. So it analyzes, oh, I just had a senior moment.
That's okay.
It
It
is, I
looks
think,
pretty compelling.
16 categories of skin in 2D and 3D. And then it also does 4 categories for scalp and hair. So
Wow.
it's, yes. So if you do hair treatments, it's really good for that because sometimes with hair, it's hard to tell the progress, but it actually analyzes the follicle diameter, the density, the scalp, all of that. So it's a really great tool to have in your treatment room because sometimes, we see things and we tell clients, but it gives more credibility to the things that we see and we're telling them. And this
Fabulous.
analyzer actually, and it's not on the report here, for your clients, you can print out this report for them. And on the sidebar, it will recommend your services and your products that go along with the issues that the analyzer finds.
So you
What's
can
the
personalize it to your services. Yeah.
what's the name of it, the analyzer?
It's DP Skin. And there, like I said, there's a couple different tiers to that. So there's the DP Expert, the DP Essentials, and then the oh
Why don't
gosh,
why don't we list it at the end of the program or send it up in the following up email, and we'll send all that information to anyone who's interested.
yes, for sure. So yeah, so that's the analyzer there. And like I said, it's a great tool to have. It helps you sell your treatments, your products, helps you sell packages too, right? Because if your client is talking about texture and you show them the texture in their skin, now it's easier for me to sell them that package of peels.
Yeah, I'm blown away. It's kind of reminds me of Vizio, but maybe more advanced.
It is, it analyzes similar to that, but very different.
Yeah.
Yes, and the,
Yeah.
the price point is it's a lot less than the Vizio.
Okay, well,
So
very
okay,
exciting. Love it.
yes. So I'm gonna get out of here and I'm gonna turn it over to Vincent, who will talk about the first part of what I did here, which was the AMiKO peel.
Wonderful. Thank you, Karla.
Thank you. All right.
Appreciate the opportunity. All right, so we're here to talk about the AMiKO peel. I've already introduced myself. Again, my name is Vincent, and I've been in skincare for, it says 25 years, but it's been since 1996, which means it's almost 30 years, actually, which is a little scary. But we move forward and we move onward. And how do I get this to go forward? Help. Why is it
Go
not?
on to where your slides are and then hit
Oh, I
the,
just click it. Okay.
yep.
Okay, so AMiKO, what is AMiKO? AMiKO is the very first next generation peel to be formulated with colostrum, which is the first liquid that is expressed from the mammalian breast after birth. We'll get into that. AMiKO is a peel that is counter to everything that we know. It's kind of a new advent or a revolution in peels, if you will. The challenges with traditional peels are that we are concerned with downtime. There's a lot of downtime. There's irritation. There's actual physical peeling, which scares people. There's discomfort. There can be a lot of pain associated with it, especially when you get into the more medium or deeper peels. And the formulas can be very aggressive, and some of the outcomes can be sort of unknown. Um, Let's see, there we go. And so we're here to talk about AMiKO, the MC monochloroacetic acid colostrum peel, which is counter to everything I just said. No downtime in our peel. The formulation is advanced, no pain, no discomfort. It's safe for all skin phototypes and all Fitzpatrick scale skins. It is a self-neutralizing peel. It is stable at room temperature. It does not need to be refrigerated. And it's a fast 10-minute standalone treatment, but of course it can be combined and stacked with other treatments. Being powered by colostrum means that it is a healing peel. It assists in the healing of the skin and repairing. It doesn't just mask or eat away at the dead skin and leave a tight, sort of glowing skin that's temporary. This is a peel that actually treats and delivers on its promises. One of the most amazing things about this AMiKO peel is that it extends the life of skin cells by producing the enzyme telomerase, which treats our telomeres, which is the way we sort of understand how our skin ages. And when we have poor lifestyle or illness, our telomeres are degraded and we age more quickly. That could be due to diet, illness, lifestyle, sickness, glycation, something we don't talk a lot about. First time I've actually seen and heard of a peel to treat those conditions. So we can get more in depth into that, but that's the first time that we've seen that. And colostrum has been proven to do that. You may all have heard of colostrum and or know that within the the last few years that colostrum supplements have become a very big business because they support our immune system when we ingest them. And just like that, this colostrum peel is supporting the immune system of the skin and the microbiome and making it stronger. It boosts the fibroblast activity so it can produce and induce collagen and elastin. And how does it do that? Well, there's over 100 bioactive compounds, nutrients, antioxidants, and peptides in our formula. So it speeds up visible skin recovery. The bioactives that are at work, as I just discussed, are antioxidants that protect and repair the skin, amino acids, which are the building blocks of protein. So we're inducing collagen and elastin, which is a anti-aging or pro-aging formula. Think fine lines, wrinkles, think hyperpigmentation, texture, as Karla just mentioned, just an improving overall health of the skin. And of course, there's a cumulative benefit. The results get better each time you do the treatments, and you can do the treatments as soon as every 10 to 14 days because there's no photosensitivity and there's no extended downtime that one would traditionally associate with peels like first generation peels. The growth factors that are in there, of course, growth factors are all the rage. There's an amazing amount of growth factors in colostrum. So this is the first time that it's actually been balanced and stabilized to be put into a peel formula. So we know that that will stimulate healing and regeneration of the skin. And whenever you can do that, you're going to deliver the best skin for the person in front of you. And of course, the immune peptides in there will reduce inflammation in the skin, which is why this peel is so good for conditions like rosacea, which is kind of shocking because formally, you haven't really been able to treat skins that have rosacea, especially in a flared up stage. Why does MCA or monochloroacetic acid matter? Well, it's a gentler profile, as it says there. It's the gentler cousin of TCA, which can be more aggressive and have uneven outcomes. This is an effective exfoliation. It is going to deliver minimal irritation with no long recovery period. We know that it's self-neutralizing, so we don't have to worry about any issues that might occur after the peel. The results are consistent and predictable. That is what we want as practitioners. That is what we want in the room. We want to know that we can deliver on our promises and we can deliver the results that our customers are looking for so that we can achieve our skincare goals. And the only way to do that is with a formula that you can rely and trust upon. This formula is compatible with other combination treatments and is stackable, like treatments like microchanneling or mesotherapy. Some photos here for you. What one can expect after a treatment is a smoother, plumper skin, improved elasticity and hydration because we're correcting imbalances. We're regenerating the skin. You'll see a reduction in fine lines and pigmentation. So it's certainly an anti-aging treatment peel. And this can be done, by the way, every month of the year, 365 days a year. There is no peel season anymore with advanced next generation peels like AMiKO. Of course, this is a great time to be doing them now in the fall because we're not vacationing, we're not in the sun. So it is ideal to start a program now, but it is safe for all skin, including acne-prone skin, the most sensitized reactive skins, and mature skin. Next, what can the clients experience and expect? Well, it's a fast application and easy protocol. As mentioned earlier, you can do this in as little as 10 minutes. You combine this with advanced treatments like microchanneling, microneedling, or mesotherapy. You can depend on the formula because it's stable at room temperature. No special storage needed. Of course, you always want to store in a cool, dark place. Don't put it on top of your hot towel cabbie, folks. We tend to forget that. And it can fit seamlessly into any treatment menu. More importantly, it has a high return on investment and low cost. When you purchase the AMiKO peel, you'll be getting 5 10-milliliter vials, which are hermetically sealed with rubber stoppers, so you will pull it out with a syringe. So it's very clinical in the way that it's pulled out of its stopper and produced and applied to the skin. So you're getting at about 25 to 26 treatments out of the vials. So your cost per treatment is actually a little bit lower. It's actually $20 to $22, depending on what area of the body you're doing, which is actually a really great entry price. The suggested and national treatment menu price for this peel, for the AMiKO peel, is somewhere between $200 and $250 onwards. And your profit per box, when you think about all of the math there, if you're not a math person, just look at this screen, you can achieve an average of about $5,000 return on investment for a simple investment of about $500. So actually quite profitable, and it delivers on its results. And it's the first time again that colostrum has been used in a next generation peel. Karla or Abby, any questions before I go on? I know I'm speaking quickly. I just want to be sure I'm being clear.
Are you, oh, sorry. I was just gonna ask you if you were gonna go through like the step-by-step protocol,
Yes,
but
that's our
you're
next few
there.
slides
Yeah.
there. So just a quick overview of how to perform the application. You'll want to double cleanse and degrease the skin. On average, you'll apply 2 milliliters of the AMiKO peel. You'll leave it on average, again, for about first-time customers, 3 to 5 minutes. You can neutralize the peel and remove it with cotton gauze soaked in water. And then you can apply and should apply per the protocol. We want to be clear on this because the protocol is what delivers the results. So we're excited about that. We have an antioxidant auric serum and a colostrum cream that is applied afterwards to really give that beautiful AMiKO glow. And again, this can be repeated. Ideally, recommend 4 to 6 sessions, 7, 10, 14 days apart. However, you can schedule your customer into your treatment room. That also would depend on the treatments that you see before you. Here's a quick video of how to perform the treatment.
Hold the peel vial firmly and with a small pair of pliers, grip the circular tab in the center of the metal top. Lift and twist gently to remove the tab. This will expose the rubber stopper while keeping the rest of the metal band intact. Using a blunt tip cannula attached to a syringe, draw up the correct dosage for the treatment area. Cleanse the skin thoroughly using auric cleansing mousse to remove all impurities and prepare the skin. I like to first remove my cleanser with dry 4x4 aesthetic wipes, followed by a damp towel or facial sponge. Make sure the skin is completely dry before application. Using your gloved hand or a fan brush, apply an even layer of the peel to the skin. Do not massage. For the face, leave the peel on for 2 to 3 minutes. Remove the peel with 4x4 aesthetic wipes dampened with cool water. Continue until all product is fully removed from the skin. For sensitive or reactive skin, follow with a neutralizer, even if there's no visible reaction. Use any professional grade neutralizer you have. Follow with the AMiKO post-treatment cream and finish with a broad spectrum SPF 30 or higher to protect the skin.
How great was that? Really great little demonstration video. You can see how quick and easy it is to perform the treatment. I want to say that being a next generation peel, it's really harnessing the power of advanced technology. We now can use the mechanism of the peel as a potentiator for active constituents like colostrum to penetrate deeply to add nutrition to the skin. So while you're getting a peel benefit, you're deeply adding wonderful nutrition to the skin to correct imbalances, regenerate, and repair. Don't let this peel fool you. It's quite powerful. It's just delivered in a responsible, gentle, effective way. And this graphic that you see before you, you can see right away that there's an increase in the density of the dermal layer after just 7 days of using the colostrum AMiKO peel and also the cream. Look at that right there. That's after just one treatment. And we see amazing results after one treatment, although we do prefer that you do at least 3, 6 treatments in a row as a series because the results do get better. The skin is alive, right? It's always experiencing external aggression. So we know that, like going to the gym, you're going to want to perform these treatments on a regular basis to achieve your skin goals with your client. But the proof is in the pudding and the science is there for sure. All right, let's get into some quick ingredients. We want to move this right along here. Some of the active ingredients in the AMiKO peel include lactic acid, salicylic acid, allochon, calming, soothing, allows the peel to penetrate without eating away the top layer of skin. So that's why we have no sensitivity or photosensitivity or irritation. Panthenol boosts hydration. And of course, the amino acids we talked about earlier, proline, glycine, and lysine, which are responsible and essential for collagen synthesis and elasticity. Tell me that is not the end of my program. I know there's more. What do I do here? Oh, there we go. Just clip my bounce there. Okay, moving on. There are retail products and post-treatment products associated with the peel. And you should just know, as you saw in the video, we use the cleansing mousse. There is a antioxidant treatment serum. There is a post-treatment cream, both available in back bar as well as for retail. That's the day cream, and that does contain the colostrum, referring back to that graphic where you saw the increase of density in the skin. So it's actually a treatment cream, and it's quite effective. So we recommend that you use that post treatment, and also recommend that to the client to use at home. In addition, there is a night cream which has some retinol in it. So it's really wonderful, rich night cream for your customers with just a touch of retinol to keep that skin glowing, renewed, and looking its best. Moving onward,
I
contraindications.
just wanted to share, sorry, the night
Go
cream
ahead.
is my favorite from that line.
Yeah.
It does have the retinol, but it's so gentle and still effective.
Yeah, I will say I love it. I love all the products, but I felt like in the summer it was just a touch too rich for me. So I would just dot and blend it, and I wouldn't overuse it. I will say the products are highly concentrated, so just use pea-size amounts where needed and add more as needed. Don't overuse the product. And that also, of course, saves you on your investment. But yeah, really rich, concentrated, wonderful products. The antioxidant serum's also quite concentrated and quite powerful. So start with a little less so you're not overwhelmed. Use a little bit more. Let your skin kind of ease on in to AMiKO Street, and you'll achieve best results. Typical contraindications with most clinical treatments, of course, would be pregnancy and or breastfeeding, immune disorders or conditions like cancer or steroid use. With Accutane, of course, we're going to want to wait several months before treating because we know that that prescription can thin the skin and make it more fragile. And anybody who's on antibiotic therapy, of course, open, abraded, or angry skin, typically we don't want to treat. However, if your client does have rosacea, you can use this AMiKO peel. And that, of course, we will train you after purchase so you have all the information that you need. Real results, real professionals. Just to let you understand what I've been talking about, I'm making this bigger on the screen. I hope you can see my amplification of this. You'll see the rosacea treatment with the lady on the left with the fabulous brows. Look at that before and after here, the redness in the cheek area. You can see it's calmed and soothed. That's the colostrum at work, the panthenol, the allochuan. Going on here with the lady on the right, you can see she's got some breakout. She's in distress here. And on the bottom, of course, we're in great distress. She's got a whole lot. I think that's the same lady, actually, because I can see the forehead looks quite similar as the one on the top right. But look at her before and after, and that's after just one treatment. And I can tell you through the photos that I've seen and the testimonials that I've heard, as well as my own clients and my own skin, the results only get better and better. It's a constant nutrition and support of healing to skins, especially skins in distress. Moving on. Is that my last slide, Karla? Maybe. Let's see. Maybe I have to go back to full screen. Right. Okay. The AMiKO difference, of course, it's the science, it's the results, it's the business. Folks, this couldn't be easier to install. Again, what's amazing about it, it's the first time colostrum's ever been stabilized to be formulated in a concentrated, effective way in a next generation peel, not even a traditional peel. Colostrum is used in some retail products, but this is the first time clinicians can use something so powerful, so easy, with results that are so noticeably transformative. So I will tell you, blending the science with the results and the ease of use with this, and of course, the high return on investment with an easy protocol, you'll love it. You'll absolutely love it. Professional accounts are available to those licensed professionals, spa owners, doctors, nurse practitioners. Training and marketing support are absolutely included. We're in love with this peel. We want to support you every step of the way. So you can find our contact information below, info@amikopeelusa.com. Our website is amikopeelusa.com, and our Instagram page is @amikopeelusa. We have a phone number. You can always approach myself or Karla to find out more information, and we would be happy to sign you up and be a partner with you on AMiKO. If there are any questions, I'll take them. If not, we'll move on to how you can blend this with other treatments, such as the specialty creation by Miss Karla Barrick, known as TalaDerma.
Great.
And I have to stop sharing my screen, right?
Yes, I'll share
Okay.
mine. You stop
There you
yours.
go.
Okay. Perfect.
Any questions? Was that clear? Do you think I messed up anything?
think you were great. Yeah, if there's any questions, just ask away. And if you think of something after this, you can reach us and we're available to you.
Thank you.
So, TalaDerma. So most of us spend our time mastering protocols, perfecting our advanced treatments, our laser settings, or whatever device and modalities that we're using. But the one conversation that doesn't happen enough, or sometimes doesn't even happen at all, is what happens after those treatments. So after your client leaves, after they've left your treatment room and the inflammation sets in, that's where the long-term results and your reputation actually live. Your results are going to depend on what happens after theirs. So every treatment, especially our advanced treatments, they stress the skin. That's normal. And inflammation is also normal, but we want controlled inflammation. When it lingers or it gets out of control, it does affect our end results. It increases our risk, or your client's risk, for PIH, or post-inflammatory hyperpigmentation. And it also affects your client's trust in you. As I mentioned, I'm also in the treatment room like many of you. So I know that feeling when you feel like you did everything right. Your client leaves and you're so excited about it because you just know it's going to be amazing. And then your client doesn't feel the same, right? Day later, 2 days later, they're calling you because of the downtime, or because of the inflammation, the redness, and all of that. And that usually happens because their skin is not being supported properly at home for the treatment that they received. And so post treatment is really, really important with our advanced modalities or anything that we're doing professionally. So what happens after advanced treatments, right? So first, the barrier is compromised or disrupted. Sorry, not compromised, it's disrupted, which is normal. It's normal, but it opens the door to transepidermal water loss, irritation, among other things. And then from there, we have the inflammatory cascade. This again is normal, but if it lingers, it can create complications, like I talked about earlier, the post-inflammatory hyperpigmentation and things like that, because it can activate the melanocytes, our pigment producing cells in our skin. And this is why our higher Fitzpatrick's 4, 5, 6 are at a higher risk for PIH, because they have more melanocytes in their skin. And then from there, for the post-treatment skin response, it's going to be collagen temporarily breaks down before the rebuilding process. So the rebuilding process is the end stage of that. And this is the healing window. This is what's known as the healing window. This is the first 48 to 72 hours after advanced treatments. And it is a very, very critical time, because this is when skin is in repair overdrive. And what you do or put on the skin during this time can either support your professional treatment, support regeneration, or it can hold it back. And this is why post-treatment should not be optional. It's strategic and it should be non-negotiable. I find a lot of times estheticians shy away from that. And I think part of that is financial. For a lot of estheticians, they'll tell me, well, they're already spending this money with me in the treatment room. They feel bad, or they don't feel confident in recommending the post-treatment because of the cost of it. Well, getting just your professional treatments in the treatment room and not supporting it at home is like only getting your teeth cleaned at the dentist and not brushing your teeth every night, right? Your client is home and much more than they are in your treatment room. So what they do at home to support your professional treatments is really key. My slide's not moving. There we go. So the missing piece. So we don't necessarily need more time or more complicated steps in our protocols. What you need is just smarter support. And that's what TalaDerma was created to do. It's created to fill that missing space between your professional treatments and full recovery and home support. And that's so that your results, you'll get better results, results last longer, your clients heal faster, and your clients will love you for that, right? You're going to be the hero because they're getting exactly what they were expecting from their professional treatment. NAD plus. So NAD plus is nicotinamide adenine dinucleotide. This is energy metabolism. It is what fuels our cells or our body, right? So it's really key to recovery. Every repair process, cell turnover, collagen remodeling, inflammation control, all require energy. And that's where NAD plus comes in. It's a coenzyme that powers those processes. And without enough of it, energy supply runs low and your recovery is also affected by that. And then we have cellular repair. So NAD plus supports the enzymes responsible for DNA repair. UV exposure and oxidative stress and treatments all create small amounts of DNA damage. And when NAD plus levels are replenished, those enzymes are able to work more efficiently and help your skin repair itself and recover faster. NAD plus supports fibroblast activity. It allows those cells to synthesize collagen and elastin more efficiently. When collagen production is optimized, the skin becomes stronger and more resilient. It's firmer, and your skin is more resilient against damage. I always like to say, think of NAD plus as your cell phone charger, right? Your advanced modalities, and if you're using things like growth factors and exosomes, that is your cell phone. And to allow your cell phone to work at its best, you need the cell phone charger, right? To power it. And so that's kind of what NAD plus is. It's not your exosomes, it's not your growth factors, but it is the energy or the cell phone charger to that, if that makes sense. Any questions? Good. Okay. So in TalaDerma, we have 3 targeted formulations. Intentionally, this line is kept simple. I know that a lot of you already carry at least one skincare line in your treatment room, some 2 or 3, and I'm not trying to replace any of those. These are designed to complement what you already have. The 3 formulations are built around NAD+. So the 3 targeted formulations are, the first one is the VitaFirm. This one is all about collagen support and firming. This formulation includes copper peptides such as GHKCU, which is the most studied copper peptide in skin repair. It activates the fibroblasts, improves wound healing, and signals collagen and elastin production. And it also contains matrixyl 3000, which is another well-studied peptide in skin repair. This formulation is packed with your peptides and your peptides and the NAD+. So again, collagen and firming for the VitaFirm. And then we have the LumiVive, which is our pigment control brightening formula. Again, NAD+ is in the heart of this. And it also includes arbutin and glutathione, 2 clinically studied ingredients that target pigmentation in different ways. We have arbutin, which inhibits tyrosinase activity to slow melanin production, and glutathione, which supports antioxidant defense and helps rebalance how pigment is formed. And then the third formulation is our CicaDerm. This one is your calming and repair formulation. It includes Centella asiatica, which is one of the most researched botanicals for barrier repair and for inflammation. And we also paired it with kojic acid to help prevent PIH, which makes it a perfect choice after more aggressive treatments. So these 3 formulations are in our boosters here, which our boosters are pro only. I'm going to get into that in just a second, but the three formulations are mirrored within our boosters and our ampules so that your clients have a consistent system that's easy to remember and recommend. So the boosters, these are, as I mentioned, professional only. They are meant to integrate into your advanced modalities. So that can be your microneedling, microchanneling, lasers, peels, any of those advanced modalities that we have. And it's meant to integrate into your protocols without adding any more time to your treatment or your appointment time, and without complicating your protocols. So basically these boosters, with almost any modality, you are going to complete your protocol. Like for the client that I was showing the before and after, I completed the AMiKO protocol for her. And then when I was done with the peel, I used the VitaFirm collagen and firming booster for her. And so you do that with almost any modality that you're using. So if you're microneedling or microchanneling, you're not needling these into the skin, but you're going to apply it immediately after. And that will be the same for lasers. You can complete your laser treatment and then you apply these after. The ROI on these boosters, it's about, the recommended add-on price for the booster is about $75 to $100. And your profit per booster is going to be about $53 to $100 per booster. So there are 5 boosters in the box. And I will say that there's more than enough to do one face in each of those syringes. But I do want to stress that if you are splitting syringes, you want to make sure you're doing that in a safe manner without cross-contamination. And I do go over that with our customers on how to split those syringes safely. So yeah, so profit per booster is going to be about $53 to $100. Again, no additional time to your treatment protocol. You're just going to apply it on afterwards. And then we've got the ampules. So the ampules are the home care piece to this treatment line. So the boosters are your professional treatments. You're going to apply that immediately after. And then the ampules your clients will use daily at home to support your skin goals, whatever it is that you guys are working on. So post-treatment care sets the foundation. It's what clients do at home every morning, every night that determines the long-term results of what we're providing in the treatment room. Again, if they're not supporting it properly, you know, they're not going to get the most out of those professional treatments that they're investing in. So it's really important to make sure that your clients are on the right products at home, not just products, but the right products to support their skin goals. And that's where the ampules come in. They're engineered for the home use. They help your clients maintain and enhance their results. And again, they're targeted. So whatever your client specific skincare needs are, you would select the appropriate ampule for that. Or they can use 2 different ampules. Like, for example, I use the brightening formula in the morning, and then I use the VitaFirm in the evening. So the VitaFirm, I'm sorry, the LumiVive formula, I just realized I totally skipped that whole thing. Oh, no, sorry, we didn't. That has also 2 forms of vitamin C, stable vitamin C, which is MAP, magnesium ascorbyl phosphate, and THD, tetrahexyl decyl ascorbate. So they're stable forms of vitamin C that are non-irritating, so it is your antioxidant protection as well during the daytime. And then at night, I do use the collagen and firming formula. And then the last product in this line, and this is the only one that does not contain NAD+, is the Biome Restore Oil. So this, the oil you can apply immediately post-procedure after your microneedling, microchanneling, again, any of those advanced treatments. And it's also home care. Your clients can use it at home to reinforce and repair their barrier and also balance their microbiome. Yeah.
Carla, I love everything I'm hearing. Typically, however, we understand that putting an oil on post-clinical procedure, like with microneedling or microchanneling, is typically not something we'd recommend because we're worried about comedogenic clogging or breakout pustules. Why can this product be used safely?
Thank you for that point. Everything in the TalaDerma line is acne safe. I want to point that out. It is acne safe. There are different types of oils. Some are going to be more comedogenic than others. The Biome Restore oil does not have any emulsifiers or things like that because I wanted it specifically to be able to be used post-treatment, specifically collagen induction, your microneedling or microchanneling. It contains squalane, Centella asiatica, panthenol. So things that are calming and restorative for the skin. Uh, if you get a chance to use this oil, you'll see that it absorbs into the skin. It doesn't sit on top of it like an occlusive type of an oil.
Would you say it's similar in, I guess, makeup to our own sebum, lighter?
So it is, yes. So it is more like our own natural oils in our skin.
Okay.
Exactly that. Yeah. So it is for post-treatment in your treatment room and then also for home care. A lot of my clients will use this either in place of a moisturizer or before their moisturizer. I love kind of cocktailing sometimes because I get lazy, just being honest. So a couple drops in your moisturizer, especially in the fall and winter when it's colder, skin is drier, a couple drops in there. You can also put a few drops like in your body lotion for that extra moisture and hydration. Also in your foundation, just like one drop if you want to have like more of a glow, natural skin finish glow, just one drop in your foundation also works.
You know, it sounds so
So
interesting because we're taught usually post-procedure to put hyaluronic acid on, and that dries up so quickly, and it's constant application because your skin is usually dry and tight after procedures like this. But this actually makes more sense because you're sort of cocktailing and sandwiching in the benefits of hydration and really making the skin comfortable, calmed, and soothed.
yes, because hyaluronic acid, right? Like, okay, you put hyaluronic acid on after, but if the skin is already dry, hyaluronic acid needs water, and you're just laying it on top. And if you're not locking it in, um, and I've done it myself, like after treatments, right? Like it feels fine when you put it on, but long term, it's not really giving you the moisture that you need. So you can still use your hyaluronic acid if you want to put that on, and then you can put the Biome Restore oil on top of it. The CicaDerm line does contain some hyaluronic acid in there as well. So yeah, so you can do that, or you can do, if you have just hyaluronic acid that you use, you can do that and then lock it in. It's going to work much better when you've got both of those working together.
Great. This sounds like a superstar product.
Yes, I will say this one, most of my customers sell out of this really, really quickly.
Great.
These days everyone's doing TikTok trends or getting their advice from TikTok or Instagram, and everyone's barrier is wrecked.
Love
So
it. Love
this is a really great product. Actually, I just going into photos here. So let me show you. There's one I want to show you guys. So these are all post procedure. That first one there to the left is combination of peel and a collagen induction using my same combination, the LumiVive brightening formula in the morning and then the VitaFirm collagen formula at night. And you can see the improvement there on pigmentation and texture of the skin. The one there in the middle is an AMiKO peel, and it's actually the brightening formula she's using. Yes. So one AMiKO peel and the LumiVive formula and the Biome Restore oil. The
So you
one
can
to
really
the
see a benefit
yeah,
of post-inflammatory hyperpigmentation or just some of the redness post acne is cleared up
yes,
greatly. Yeah.
absolutely. Um, with acne, the first step to clearing acne is always barrier, right? We have to take care of the barrier before anything else. So that Biome oil works even for acne clients. The one to the right
Is
there.
Carla, can
Oh,
I
go
ask
ahead.
a question?
Yes.
Is the oil a retail product that they're being sent home with, or is this a post-procedure product that we're using after collagen induction therapy, or both?
Both. It's both.
Oh, yeah.
Yeah. It is both.
Thank you.
Like that. Yeah. Thank you. The one on the right there, that was a client that came into me for a treatment. We were supposed to do a stack treatment, including peels, but her barrier was really badly impaired. She had done some DIY treatments at home. That before a picture doesn't even do justice to that because she had blisters. She had literal blisters there. So she took home the oil and just applied that a few times a day. And that after photo is like 24 hours later. So it really helped to restore her barrier.
Random question, could you use the oil post-waxing?
I'm not a waxer, but
I think
yes, if you use oils, yeah.
Yeah.
I
yeah.
do have I have clients that also use it for dermaplaning.
Okay.
If you oil dermaplane, yes. So yeah. Okay, so those are those three. And then here, that first photo on the left is a client with rosacea. And that is, oh, I want to say that was after, it's a CicaDerm is what she's using, and the Biome Restore oil, and after one IPL. The one in the center there is another rosacea, and that's also CicaDerm. And then the one on the right is using the LumiVive, the brightening, and the Biome Restore oil. So, like I said, these are meant to easily integrate into your protocols. It's not meant to complicate anything. And then also support your clients at home. So if you have your retail lines, they still need their cleanser. They still need whatever other things that you normally recommend for your clients. And even moisturizer, sunscreen, all of that. So you can still pull those from your retail lines, and the ampules just kind of work within that. Yes.
Karla, I understand that this is a labor of love. I understand that you created something that you wanted to be efficient and efficacious. Tell us, would you consider this clinical grade skincare compared to just random cosmetic skincare product that you might buy at Sephora, the vitamin C's, the hyaluronic? What's the difference so that our clients understand really the seriousness and the effectiveness of your products?
Yeah. So in the process of formulating these, I actually learned a lot myself, right? Because yes, we do have the Sephora's, we've got the drugstores, and then we have our professional products. And while a lot of them might have similar ingredient profiles, there is a difference in the quality of the ingredients, the quality of the peptides, and also the concentration of those ingredients in the formulation. So as you saw, like with our boosters and the ampules, they have similar profiles as far as the peptides or whatever key ingredients are in there. But the concentration levels are a little bit different, right? Because the boosters are meant for immediately post-treatment when the skin is more receptive. And then the at-home products are still highly concentrated, but not at the same level as the boosters, because that's your daily maintenance type product. So yeah, so you'll find things at Sephora and all of that. But when you're using professional products, they are meant to target specific skin issues. There's no added fragrances and dyes and things like that.
Okay.
Yeah. And I already spoke about this, about integrating very easily into your treatments, not trying to complicate anything or add a lot of time. Because I know a lot of you are busy, but this gives you an opportunity to give your clients better results. And also for you as a practitioner, it helps you increase your profitability for that treatment. So business benefits, no minimums, no medical directors required. I did not put minimums here because I recognize that we have practitioners from all different types, right? Some are brand new, they don't have as much cash flow. Some are bigger med spas that have, more cash flow to invest in things like this, but I wanted it to be accessible to everyone. You do get protocol support and education included with your purchase. And you have one system that works both in your treatment room and also for your retail.
Wow, sounds amazing.
Yeah. All right, and we've got that. I'm gonna just kind of slide through these so we can get moving here. So we do have a special offer for webinar attendees, and it is the full AMiKO and TalaDerma bundle. So you'll get your AMiKO peel and one of every TalaDerma product in this bundle. And to take advantage of that, you just need to reach out to, sorry, to Vincent or to me. You can email, call, and we can help you get started with that. And as always, this will come with your training and protocol support as well.
Karla, this will, I know that it's two different brands and shipping.
Yep.
Will this all ship as one shipment for the reduced FedEx rate of 2 days? Okay, great.
Yes.
Well, that's
Yep, and we'll
great.
save you on shipping because they will all ship together.
Yeah, we really
Yeah.
wanted to create a great special for you folks. So call with any questions, reach out.
Yeah.
What a wonderful collaboration this has been.
Yes.
The results have been amazing. Karla, I'm really impressed by the formulation of those products. I have tried some of them and I love them. And we really try to align ourselves with other clinical products that take skincare results and our clients' needs seriously.
So thank you for that. And you can actually, that photo right there is another AMiKO peel followed by the TalaDerma. So
Can you put that
that
one back up?
I look this. Oh, sorry, I just realized I stopped sharing it. Let me share it. Let's see this one here, and I don't know how to make it bigger because
Oh,
it's on
wow.
full screen.
Yeah.
Yes.
Okay.
So that's immediately post treatment. And I
Yeah,
think that's actually, yeah, you can
the
see that's immediately post treatment there.
glow up is beautiful. That's
Mhm.
quite nice. Okay.
Yeah.
Wow, this is amazing. What a great webinar this has been.
So yes. So thank you for that. If there's any questions after this, you can reach out to again to Vincent or to me, and we're happy to help you.
And as a
Anything
reminder,
else?
this has been recorded, so we will be sending it out to anyone who's missed it. So if you're viewing this recording post fact, the special will apply to you. All the contact information is there, and we are excited to partner with you on just the AMiKO, just TalaDerma, but I can tell you the winning combination is both. So reach out. To know it is to love it, and I want to thank Karla for her expertise and her for collaboration here. And we look forward to doing some business with you folks.
Yes. Oh, and I wanted to point out, if you do already have TalaDerma and you're looking for AMiKO, we can help you there and get you a great deal on that as well, and vice versa. If you have AMiKO and you're looking for TalaDerma, we can work that out for you as well. And if you don't have it, either one, the bundle is a really great deal.
Yes, very good.
All right. Okay.
Well, thank you so
Well,
much, Karla.
thanks, Vincent, and thanks for joining us.
And you must have some of that product on because that skin is glowing.
Oh, thank you. Thank you.
Okay, well, I guess we'll end it here.